Hi, my name is Leitu. Have you ever been kicked in the chest by a ball or even hit in the stomach while fighting? That horrible feeling of gasping for air. Or maybe even swimming at the beach, then suddenly someone grabs you, pulling you underwater, and all you're trying to do is breathe because they were drowning? Well, that's just a glimpse of what asthma is. I bet you're wondering, how would she know? Well, look no further. I too suffer from asthma. In Australia, more than 2 million people have asthma and has shown that it will increase in the next 2 decades. A study also showed in 2015 more than 400 people alone in Australia died from asthma. Throughout my presentation, I'll be discussing one high priority clinical manifestation in asthma. I'll be emphasizing on the case study of Mr. Smith and the pathogenesis causing his clinical manifestation. Finally, addressing the clinical manifestation with high priority nursing interventions within the healthcare system and how to improve. What is asthma? Asthma is a chronic lung disease which can be controlled but not cured. In clinical practice, asthma is defined by the presence of both of the following: excessive variation in lung function, variable airflow limitation, for example, variation in expiratory airflow that is greater than that seen in healthy people, respiratory systems, for example, wheeze, shortness of breath, cough, and chest tightness that vary over time and may be present at any time. Individuals that have asthma, such as Jackson, have high risk of acute exacerbation, usually a result of exposure to triggers that cause an airway inflammatory response. Triggers include allergies such as pollen, dust, animal fur, infections, and social factors like smoking. Symptoms of asthma is dyspnea or shortness of breath, chest pain or tightness, wheezing, difficulty speaking, fatigue, and tachycardia. Mr. Smith was admitted to the emergency department with severe breathlessness. The main two assessments looked at from A to G in Jackson's case study is A and B, as most of Mr. Smith's presentation to ED were due to his severe dyspnea. Airway, Mr. Jackson's maintaining low, breathing, spontaneous or room air. This shows that his SpO2 is 93% and his respiratory rate is 32 beats per minute. He also has auscultation of lungs, identified with diminished breath sounds and wheeze. His circulation, Mr. Smith has tachycardia with heart rate of 130 beats per minute. Dyspnea. Dyspnea, also known as shortness of breath, as stated by Coggett et al., is an impact of individual or a person's insight of difficulty in breathing. Depending on how severe, that includes how a person's reaction to the feeling of suffocation with not enough oxygen. The cause of dyspnea is unknown. The pathogenesis causing Mr. Smith's clinical manifestations stated by Paul et al., the common denominator underlying all forms of asthma is an exaggerated hypersensitivity response to a variety of stimuli. Air inflammation is manifested by the presence of inflammatory cells, particularly eosinophils, lymphocytes, and mast cells. And by damage to the bronchial epithelium contribute to the pathogenesis of the disease. A person with asthma experiences signs and symptoms from occasional wheezing and feelings of chest pain to an acute attack. The attack differs from individual to individual. There are also different types of asthma, such as bronchial asthma, extrinsic atopic asthma, and intrinsic non-atopic asthma. Thick mucosal edema, and smooth muscle spasm causing obstruction of small airways that occurs in asthma. Breathing becomes laboured and expiratory and difficult due to the airway restrictions. The developed stage of the patient and a normal aging process can affect tissue oxygenation. Jackson is an 18-year-old who is exposed to multiple cardiopulmonary risk factors such as lack of exercise, eating processed food, stress, occupational hazards, drugs, and smoking. Nutrition is a high demand in asthmatic patients because severe obesity, lower lung expansion, increased oxygen demand. A nurse's responsibility to inform these risk factors to their patients and suggest good choices to prevent these episodes from occurring. One high priority nursing intervention that is important for Jackson is positioning in young adults. Their respiratory rate is normally between 12 to 16 beats per minute. In Jackson, we see his respiratory rate at 32. Position can greatly affect their breathing pattern because they depend on changes in intra-abdominal pressure. Fink states, it has been known that patients with asthma can breathe easier in the forward-leaning posture, which may be due to the use of expiratory muscles, the effect of gravity on the abdominal muscles, and an effect on lung volume. For instance, while the inactivity of the accessory muscles affect the movement of the rib cage and assist inspiration in this posture, gravity pulls the abdominal wall down and increases the intra-abdominal pressure. In conclusion, asthma is a chronic disease that cannot be cured, and there are many factors that contribute to this illness. Asthma can occur any time throughout the year due to environmental factors such as allergens, social, including smoking. Dyspnea is one symptom that occurs during an asthma attack. And finally, Mr. Jackson is diagnosed with acute exacerbation of asthma. With the help of nursing, smooth posture is an important way to assist the patient with being able to breathe prior to seeing a doctor and relax his diaphragm. Thank you. Thank you for listening to my presentation.